Coming up, we'll be on location at Hamilton Family Dentistry in Baltimore, Maryland, discussing the latest advances in dentistry and how they can improve your oral health and give you that beautiful smile you've always desired with one of this area's top dentists, Dr. Aaron Wolfson. Welcome, Dr. Wolfson, to the Top Doctors Interviews program.
Thank you so much for coming. We appreciate it.
Oh, it's my pleasure. Your practice, Hamilton Family Dentistry, has a wonderful history helping patients in the community improve their oral health and their beautiful smiles as well for many years. Before we get into that, I wanted to touch on your background. You're recognized as a top dentist throughout the Baltimore and surrounding area. You've helped so many patients also improve their oral health and achieve those beautiful smiles. As a matter of fact, we spoke to some of your patients. They love the care and the attention that you give and changing lives, literally. Tell us a little bit about your background and the background of Hamilton Family Dentistry.
Of course, yeah. We love our patients, so that's kind of why we're here. This practice has been here for over 60 years. Before me, there was a dentist, Dr. Hubert, who was here for his entire dental career, so he was here for 29 years, and then before him, there was a Dr. Canals, who was here for his entire career. So it's been a dental office that's been in the community for about 60 years, and, we just keep on kind of growing and trying to improve, and get better with time and, take technology to the next level so that our patients, get the best treatment that they can.
Well, I really love that because you've helped literally generations of families, right? And now you're helping the new generation and offering the advances of technology that you have here at your practice. It's a state-of-the-art practice. You offer cutting-edge procedures. And speaking of advances in dentistry, can you tell us about some of the most effective treatments that you focus on here?
Of course, yeah. It's funny that you mentioned that. We actually still see patients that have been seeing that original dentist. So we continue to see the generations, over the years. But yeah, we really try and stay up on technology because technology is always changing, and we want to do what's best for our patients to get the best treatment that they can. So to me, what's really important is making patients be able to function as well as possible. So replacing teeth, we used to kind of try and save teeth and do heroic dentistry where we would do anything we could to save a tooth because there was nothing as good as a tooth. But now, technology is advanced and dentistry is advanced where, you can place implants and they can function just as well as natural teeth. So you don't have to do heroic dentistry that might not last for so long if you can, take out some unhealthy teeth and place implants.
That makes a big difference because the technology and the procedures have come a long way, especially with dental implants, of how it was performed a long time ago with all the discomfort, long recovery time. We spoke to some of your patients talking about dental implants and how you changed their ability to eat the foods they want, the confident smiles that they're having now as well. What is the dental implant procedure like? How is it performed now compared to before?
So, what we started doing in the office also, because we want patients to be as comfortable as possible, is we've also started providing oral sedation. So patients can kind of be a little bit asleep where, their anxiety can be decreased. But basically we'll bring them in and we'll get a CAT scan to see exactly where their bone is and where all the things are that we want to avoid, that we don't want to cause any harm to, and then we'll plan out where we're going to place the implants depending on how many we're going to place, so that when we go to replace it for how they're going to chew, they're in the right position, so that the implant is positioned not only in the bone but also for what's going to go on top of it afterwards. So it really starts from the beginning and from having a good plan. The actual placement of an implant itself is a pretty quick procedure. It's fairly painless. We do get patients numb for it, but getting an implant placed is easier than getting a tooth out these days.
Dr. Wolfson, that's great to hear because what I love about your practice and your approach is that you are patient-centric. You really take the time with each patient to get to know what their needs are. You work as a partnership, you educate them, and that way the patients can make informed decisions and really choose the treatments that are best for them, and that's how you're getting these great outcomes as well.
Yeah, I think that's really important for us and kind of one of those things that we really, really try and make sure that we're doing for our patients. No two patient is alike and no two patient's brain is alike, and everyone has different desired outcomes. So really, I think it's important for us to make sure that we're listening to our patient, seeing what they truly want, and trying to educate them for what we believe is the ideal treatment plan, but ultimately letting them make an educated decision when they have all the important information in front of them.
Something we hear a lot about in society is dental anxiety. We even spoke to one of your patients that said that prior to coming to your practice, they had dental anxiety. They were afraid to go to the dentist. They would get the sweats. I think this is something that happens as children. We have these bad experiences, and in those days, dentistry was totally different. So it was like you were scared to go to the dentist. But now it's totally changed. With a practice like yourself, you make patients really comfortable. Can you tell us how you deal with dental anxiety and patients that are nervous?
Of course, and I think that's, one of the biggest compliments actually. A patient yesterday said, you made me no longer afraid of the dentist. And I think that the majority of people that are afraid of the dentist stay away from the dentist. And those are the people that need to go the most. I personally am afraid of the dentist, and I know what we do all day. I know who's treating me. I trust them 150%, but I still hate it. It's just a very invasive process, and you can't see what's actually happening in your mouth. So there's, trust and vulnerability there for patients. And I think for us, it's just really listening to what makes them nervous. What can we do to make the experience better? And anything we can do to make them have a better experience, we're willing to do it. And that's why we offer things like oral sedation in the office. So as we've kind of grown, we're just trying to do more and more and go that extra distance to make our patients comfortable. Because, like I said, your dentist doesn't like going to the dentist.
That's a great point. And another thing is that your practice is really comforting. I mean, you walk in here, you don't feel like you're going to a dental practice. Most practices are kind of sterile. You don't feel comfortable. It's like going into a hospital or a doctor's office. But this is warm and welcoming, and I love the colors, and just everyone here is really friendly as well with the patients.
Yeah, I mean, it actually starts before you walk through the door. It starts with a phone call. And I think that, another thing that's important to us, really important to us, is our staff, because patients interact with our staff probably more than they interact with me and Dr. Nolan. So, we want everyone in this office to be someone that patients are happy to see. If we can lower that anxiety even just a little bit to make it not something that they're dreading, that's kind of what we aim for.
And Dr. Wolfson, for all the viewers watching out in the community, what do you feel really separates your practice from a lot of the other dental practices?
Yeah, so I think that there's a few things. Number one is that I think that I try and look at every single person as they're my family. What would I recommend if they were my brother, sister, mother, father? And, great, we'll educate them on that. And if that's not what they want to do, then we'll come up with a better option for them and what they're comfortable. But I think that, offering someone the best treatment is most important, and educating them as to why. Taking that little extra time and explaining the why behind it, I think goes really far. The other thing that I think we really do is that, we really continue to take a lot of continuing education. So we're always trying to stay up on technology, on what is best treatment for our patients. And we continue to do so every single year.
Well, you've got a great practice combining the warmth of a family, welcoming atmosphere with the latest technology and the most advanced treatments is a winner for all the patients out there. So keep up the great work.
Thank you. We're lucky to have them.
All right. It was great having you on the program. Thank you for joining us.
Thank you so much.